Still come in expecting to be at a... Thank you very much. And ladies and gentlemen, over this last few weeks, the Executive has been able to roll back some of the restrictions that were imposed in March during the coronavirus lockdown. We've been able to do that because the rate of transmission for COVID-19, the R rate, has been driven down, and the number of new cases is now very small. And this has happened because the vast majority of you have stuck closely to the public health advice on how to keep yourselves and others safe from COVID-19. That in turn has suppressed the spread of this lethal virus within the wider community. So today the Health Minister has advised that updated letters are issuing to those people who are currently shielding. This will confirm that individuals are to pause shielding as of the 31st of July, given the current low levels of virus transmission. In the meantime, from the 6th of July, people who are shielding can meet up to 6 people outside, and those shielding and living alone will be able to form a support bubble with one other household. The Executive has today reached another new milestone in our journey towards the new normal. The ability for outdoor visits from families and friends has been a positive step forward. However, we have also been determined to see progress on indoor visits too. We've addressed it many times at this press conference. So this afternoon, the Executive has agreed that groups of up to 6 people, not from the same household, will be able to meet indoors from tomorrow. It is recommended that social distancing should still be maintained, along with other mitigations such as ventilation and good hand hygiene. The Executive has wanted to promote family-friendly arrangements, and this will also be of assistance in relation to informal childcare. This was the one relaxation remaining outstanding from the initial stage of our recovery plan, and I know many of you have been desperate in recent weeks to visit your family and friends inside their homes, and you'll very much welcome this announcement and want to thank you for your patience and abiding with us. However, as positive as this step is, all of us in the Executive cannot stress enough that the battle against COVID-19 is still very much ongoing, and we all need to remain vigilant. Over this last 3 months, we have weathered a particularly vicious storm. NISRA figures demonstrate that coronavirus has now been linked to over 800 deaths in Northern Ireland, and of course the figure worldwide is more than 460,000 deaths. We've had to deal with a novel coronavirus whose behaviours are still not fully understood and whose symptoms can vary amongst those unlucky enough to contact it. Some people have been fortunate to have had little or no symptoms. However, for others, the consequences have been severe, with some people regarded as healthy being forced into intensive care beds and indeed onto assisted ventilation. So COVID-19 has exacted a heavy toll on our elderly and on staff who have bravely treated patients in hospitals and in care homes. And we have done well to avoid our health service being engulfed by COVID-19 like other countries, but the threat has not gone. And in the absence of vaccine, COVID-19 still has the capacity to wreak havoc again, as unfortunately we're seeing in Beijing in recent days, where they've discovered a dramatic rise in infection at hotspots, and also in Germany, and as we look at North Wales as well, to see the clusters that have developed there. So complacency is a luxury that we cannot afford, and as we exercise recently restored opportunities like visiting places of worship or going to closed shops or playing sport or meeting up with others outdoor, we still need to implement the guidance on social distancing and on hand hygiene. So in the coming days, when we're able to go to a hotel or a restaurant or a visitor attraction, or most definitely a hairdresser's, we will need to adapt our behaviour and be conscious of the capacity of the virus to flare up again with fatal consequences. So we do owe it to ourselves, our family, our friends and our neighbours to keep following the health advice, because the communal spirit our community has demonstrated at the outset of this health emergency has stood us in good stead. We often stand here and say how proud we are of the people that we represent. I am incredibly proud of the way we have handled this COVID-19 crisis, protecting ourselves and the wider community, suppressing the virus, but taking risks with our safety does not help anyone in our community. So we will continue on our step-by-step process. We will continue to unlock the other restrictions that currently remain in place, but the lesson of this past few months is very clear for us all. We need to stay safe and we need to save lives. Michelle.
Thanks, Arlene, and good afternoon to everyone. We are now well advanced in our recovery journey. Our shops and other retail are open. Our tourism and hospitality sectors are preparing to welcome people back safely. Our hairdressers and barbers are getting ready to reopen, and our places of worship are working towards safe reopening. Among the greatest hardships endured by people since the lockdown began have been the impact on the restrictions in place that limit contact with others. We know only too well how difficult that has been for people, and we're very mindful of how damaging it is to people's health and well-being to have that contact with loved ones taken away. We have held firm to our commitment to be guided by the scientific and medical advice and to not keep restrictions in place any longer than is necessary. And the Executive has been looking in detail at how and when we can carefully introduce more contact between families, friends and support networks. We were able to move to outdoor meetings a number of weeks ago, and this relaxation has been enjoyed by many people, myself included, as people have been able to come back together again. However, we also know that this provision has not met the needs of everyone, including many who are housebound and those who depend on families and friends for informal childcare. Today, the scientific and medical advice indicates that we can make further progress to facilitate more contact between people, and we can confirm that from tomorrow, indoor meetings between up to 6 people can take place. We've also looked at a number of models, and we believe that this arrangement provides the greatest flexibility to allow much needed social contact and enhanced support networks. In addition, people who are shielding and living alone will be able to form a support bubble from the 6th of July, and they also will be able to meet people outside up to 6 people. Crucially, the scientific evidence that we have received today indicates that this model does make it possible for informal childcare arrangements to resume. This will help alleviate some of the childcare pressures being felt at present and move us forward significantly on the key issue. This is very positive news and another step in the right direction that will no doubt be welcomed by many. We should point out that this easement does come with some very strong health advice. People should still keep as much distance as possible between themselves and others who are not part of their household. Visits should be kept short where possible. We should all continue to be meticulous in washing our hands. You are advised to wear face coverings, and you should make every effort to make sure that the environment is well ventilated. I know after spending the last 3 months apart, it will be a natural human reaction to want to hug each other. But for now, we have to continue to keep that physical distance as much as possible. That won't last forever, but for now, it still needed to be able to keep people safe. Unfortunately, those relaxations do not apply to those who are shielding, and those in the shielding group are strongly advised to follow the advice relating to them until their current shielding period is paused on the 31st of July. We are delighted, as I've said, that those people that are shielding will receive more easements today, and you will be able to meet with people outside your home, up to 6 people, as long as social distancing is observed. And in addition, people who are shielding living alone will also be able to form a support bubble from the 6th of July. So I think this is a good day as we take some more cautious steps forward. I think this should give a wee bit more hope to people, and we can all be heartened by the progress that we've made so far. It's all credit to the public for the work that you have put in as we have worked together to save lives. And whilst we still have a way to go, we should all have confidence that we have all come through this together, and we'll continue to come through this together. Thank you.
Good afternoon, Ministers. People will be very heartened, as you say, at today's announcement. So just to go through the specifics of what's been announced in terms of indoor meetings. Is it the same 6 people? Is it members of the family? How do you see this actually working?
So, no, it's not the same 6 people. That's why we didn't go for 2 households bubbling. Do you remember we did talk about the possibility of that? This is actually more progressive, if you like, Tracy, because it's 6 people at any one time indoors. We're suggesting that people still recognise the need to have some social distancing, good hand hygiene, hopefully good ventilation. But we think that this is a more progressive move, and if clusters develop in particular places, then we can move back to the 2-household bubbling, which would just be 2 distinct households being able to have contact with each other indoors. But no, this is more progressive than the bubbling, and we hope that people will find it very useful, particularly in the area of childcare. Because we do feel that that has been the informal childcare piece, and both of us have had many contacts from grandparents who have not been able to look after their grandchildren, and we hope that this gives some help in that respect.
Yeah, I mean, I think this way forward builds in maximum flexibility to allow you to mix with different people for different reasons. And also, I do think it's really important that we address the issue of informal childcare, which is basically relying on family and friends at different times to provide that childcare need. So this will allow that flexibility. People are still encouraged to socially distance, but clearly whenever it comes to looking after small children, then there is that inbuilt flexibility and people will use their common sense.
You know that you'll be very aware of the fact that it's expected that the Prime Minister will announce tomorrow that social distancing will move from 2 metres to 1 metre in England. This is something that you have said time and again has been discussed at the Executive. Could we hear something about that maybe this Thursday?
Well, we'll certainly be looking to see what the Prime Minister has to say about that, what the evidence is around that, what the mitigations will be to try and deal with moving from 2 to 1 metres, if he announces, as everyone expects him to, some details around that tomorrow. So we'll be engaging with the Westminster Government tomorrow to find out what the evidence base is for all of that.
We've always said that we keep this issue under continual review. That remains the case, all the while guided by our own scientific and medical officers' advice. And we discuss this probably at every executive meeting, Tracy, and we continue to keep it under review. We said we won't be maintaining the stark restrictions in place for longer than possible. So, of course, we just keep this under review.
Good afternoon, Ministers. Nice to see you both. Just to pick up on Tracy's question there, talking about the 2 metre rule, wouldn't it make sense that if you are allowing people to go into other people's houses, that you would naturally think about reducing the 2 metre rule?
Well, you know, again, this is something that we talk about a lot. When we look at 6 people in someone's houses, we ask our medical advisors why was the number 6 to the forefront. The answer back is that they've worked that out on people being able to socially distance in an average Northern Ireland home. But I think it's fair to say, Stephen, that these are guidelines. We ask people to be aware, and that's why we're saying be aware of your surroundings. Will we be out with measuring tapes in people's living rooms? No, we'll not. But we are asking people to be aware, try and socially distance if you can, look maybe to face coverings as well, look at hand hygiene, look at ventilation, look at all of these things in the round, because what we want to do is to keep people safe. That's always been our objective right throughout this crisis, and that remains our objective going forward.
So 2 metres is always going to be better than 1 metre. That's the science. However, when we continually review this, we have to look at all the factors that are in the round, I suppose, in terms of the disease spread. So it's an ongoing piece of work. We continue to keep it under review, and when we can move, we will move.
Interesting, you mentioned face coverings. Where are we with face coverings on public transport? Because there was an expectation that there was going to be an announcement on that, and calls today from some sporting bodies to allow elite athletes and sporting teams to practice. Where are we with that?
Well, in terms of face coverings, again, this is something that we continue to keep under review. The advice today from both the Chief Scientific Officer and Medical Officer was that we are in a position where we should be strongly recommending face coverings, and particularly in circumstances where you can't perhaps socially distance or the room isn't well ventilated, or indeed public transport. That's the current position. Clearly that over the course of time, perhaps the Infrastructure Minister might want to bring forward a paper around making it mandatory. However, in my own opinion, I think that would be difficult to enforce, and I think we need to just keep that under review.
In terms of the elite athletes, Stephen, this is something we're alert to. We've been contacted by a number of coaches and what have you, so we are looking at that I don't think it's any secret that one of those is around swimming pools and how we're able to manage all of that. Of course, the difficulty there is around the changing facilities and what have you, but we are looking at that issue presently in the executive. Hi, Michael, go ahead.
Yeah, good afternoon, Ministers. Just following up in terms of the question about face masks, is it going to be difficult to encourage people to follow any guidance which isn't made mandatory around face masks, given that, you know, we may have seen relatively limited use of them so far?
Well, I think that the medical and scientific evidence suggests that we should strongly recommend them. So it is guidance. We can only ask people to do that. I think a lot of people make up their own mind on these things. Some people have already decided that that's what they want to do. You certainly see it in shops. But at this moment in time, Michael, we have to just encourage people as per the advice that we've been given. And the advice that we've been given is that we should strongly recommend it.
And people also, Michael, need to bear in mind that if they're wearing a face mask, they are not immune from either transmitting or indeed catching the virus. And one of our concerns is that people become quite complacent when they wear a face mask because they think it's some sort of barrier to the disease, and of course it's not. It's an aid to help stop the disease, but it's not a barrier. So I think we will, of course, continue to look at this issue. But of course, if you make it mandatory, then the next question is, what's the penalty if people don't comply with that mandatory instruction? And so we have to consider all of those issues, and we'll be continuing to do that in the executive over the coming days.
Have you had any thoughts in terms of what the penalty? We're maybe getting a bit ahead of ourselves here, but have you had any thoughts about what the penalty could be for not? We
haven't, Michael, because we haven't went that far yet. So far, the conversation's all been around the benefit or not to encourage them. So we haven't went that far down the line. But surely, if we did move to a point where you were going to make it mandatory, then you'd have to look at all those things. But I do think that it would be difficult to be able to manage that.
Hello, Ministers. I hope you can hear me okay.
Yeah.
I was looking at Hospitality Ulster have claimed today that 60% of its members, being pubs and restaurants, will not reopen if the 2 metre social distancing rule remains in place. Is the executive going to stand by and let that happen, or are these guidelines going to be introduced soon?
Well, I think we have been very much involved with a lot of sectors who have raised various issues with us, none more so than the tourism and hospitality sector, because we do recognise that, of course, they had to close very quickly once the lockdown happened. And we've been working very closely with them, listening to their concerns, making sure that we come forward with indicative dates for their industry. And we have heard very clearly what they're saying to us about the social distancing guidelines at present. But we do expect some announcements tomorrow around this from an English point of view, and we will, of course, be looking at the evidence that will come forward off the back of that.
I don't think you're hearing us.
Did he not?
No, I can see. I don't think he can hear us.
Sorry, I wasn't able to hear the answer there. I don't know what happened. In the second question anyway, does the executive foresee any problems with people being told to stay at home for the 12th celebrations, with pubs reopening the 3rd of July?
Well, the last time I was at the 12th of July celebrations, it wasn't about going to the pub. It was about celebrating and going to the parades. The Grand Orange Lodge have said that the demonstrations are not taking place this year. They're talking about the 12th at home. So I think that there will be plans put in place around all of that. We realise that this is very, very difficult. There have been many festivals and many events that have been cancelled since March. This is a real challenge to people who want to celebrate their culture, whatever that culture may be, and we all recognise that, but we will continue to engage with the various different bodies who are organising festivals and try to assist them with guidance around all of that. Can't hear you, Freya.
Can you hear me?
Yeah.
Can you hear me now?
Yeah.
Yeah, super. Apologies. Ministers, good afternoon. Just wanted to ask, we've heard further welcome relaxations this afternoon, and you talked also about the importance of adhering to, you know, social distancing, to good hand hygiene, or we could end up in the scenario where maybe some of the steps that we've taken forward have to be rolled back. And I wonder, I wanted to ask you what's being looked at in terms of if measures might have to be reimposed, and specifically if you're considering anything around re-implementing measures maybe in a very specific geographic area, so possibly perhaps by county rather than throughout Northern Ireland as a whole.
I think a lot of our efforts have been about trying to prevent the resurgence of the disease. Obviously, we're at a space now where we've had, you know, some success, where we're at a space now where community transmission is extremely low, and they're all very positive places to be. But our concern is that we're going to face a resurgence at some stage in the future. So a number of decisions that have been taken have reflected that. For example, the pause in shielding. It's a pause as opposed to stop on shielding, because if we had to move back again to protect those most vulnerable, then we need to be able to do that and reactivate that very quickly. We talked earlier about the way in which people can get together and have contact indoors. We talked about having a fallback position of moving back to bubbling if, for example, we needed to. But I think if you look at practice or look at the disease spread around the world, you can see where potentially you go from widespread outbreak to actually geographical areas, clusters around, for example, even workplaces. So we're very mindful of all of that, and we may have to take measures at different times depending on what that looks like. But that's why the contact tracing is crucially important, because then that allows us to always trace back the source of the spread and actually allow us then to basically close that down as quickly as possible.
And we'll also want to, Michelle's absolutely right, contact tracing is key to dealing with all of that, because then we'll know where people who have been in contact with people who have the disease. But we'll also want to learn from the experiences of other countries where there has been clusters and outbreaks, like Germany, and indeed even in North Wales, in Anglesey and in the North East as well. So we'll be looking at those experiences and how those are being dealt with in very specific areas, Freya.
So again, I suppose just to pick up on that, and I accept we're sort of talking hypotheticals here, but say there was a clustered outbreak in a very specific geographical area, maybe surrounding a workplace, you know, is it possible that we could see specific measures put in place in that area to control the outbreak there?
Well, I think it's difficult to say what our reaction would be depending on the outbreak, because if it was in a workplace, then of course we would try and make sure that we knew all of the people affected and try to contain it in that fashion, whilst perhaps maybe looking at what Michelle has mentioned in terms of bubbling, as opposed to having 6 people in houses and all of those measures. So we can take gradual steps back, we've always said that we want to be proportionate and do what was necessary at any time. We certainly would not like to be in a situation where we had to go into full lockdown again, because we recognise the damage that has on wider society and of course on the economy, and having to revisit that again would have a hugely detrimental impact.
Thank you. That is.